healthcare system, making sure that we're able to make every single solitary person eligible for what I've been able to do with the with the COVID. Excuse me, with dealing with everything we have to do with. Look, if we finally beat Medicare.
I think that what people saw on stage did make them alarmed. And as a doctor, I myself, watching him perform on stage, I was worried for the man in terms of what was going on, because this was a very high-stakes situation for which he would have been very well briefed. And I'm thinking to myself, what's going on here? I think the question that many people are asking themselves, having seen a very surprising debate performance from Joe Biden, is what on earth was going on? So people are asking the question, is this a dementia? Is this a temporary confusion? Or is this a stress thing? Was he very stressed? And could psychological stress explain the stumbling performance? From a medical point of view, a lot of doctors have been asked since the interview what could be going on with him. And remember that it's difficult for a doctor to comment because we can't interview the client in the way we would normally do to provide a proper assessment. So to provide a proper assessment is difficult. I've been slightly surprised at how many doctors have gone down the route of suggesting a dementia diagnosis. I'm a consultant psychiatrist. I work in private practice. I have many years of working in the NHS, and it's a routine part of my job to assess people for dementia. One of the cardinal signs of dementia, particularly in early dementia, is memory loss. But what people don't realize is a particular kind of memory loss. It's short-term memory loss. In other words, people with dementia or the beginnings of dementia forget what's just happened. Right? They're often pretty good at remembering actually what happened the previous day, or even, oddly enough, many, many years ago. By the way, Joe Biden's memory has come into question by a previous report, which said many months ago that they thought he couldn't remember significant events from the past, like the death of his son from brain cancer, the correct date, and they were surprised by that. But the cardinal sign of a dementia and an early dementia is short-term memory loss, not long-term memory loss. And it seemed to me, although he stumbled and was confused, he didn't look like he suffered from a kind of memory loss that he couldn't remember the question that had just been asked of him. He appeared at times to be confused by the question, so I would suggest that a confusional state explained what was going on, and a confusional state is referred to in medicine as most likely to be caused by a delirium, and that's a temporary thing, like a medication-induced thing or a cold-induced thing. I'm not ruling out a dementia. It's entirely possible. The problem for the Biden campaign team is the reality is whatever happens in old age, and he could be suffering from the absent-mindedness of old age, it's not going to get any better over the next 4 years. And I think they don't realize the electorate's thinking that. They're thinking, blimey, this is the best there is. From now on, it's a downhill slide, as it inevitably is with anyone. It's a downhill slide for me for the next few years. I'm not going to get any sharper over the next few years, and they're a bit worried with this baseline performance. What does this mean for the next few years if he was to become the next president of the United States? And I think his campaign team have really not handled that question. Obviously, a lot of the speculation could be dispelled by things like a brain scan and formal neuropsychological testing by a neuropsychologist. And it's really interesting to me, and actually Trump challenged him over that, and Trump taunted him on that point, that the campaign team have not gone down the route of some kind of definitive assessment. That may be telling us something. The question a lot of people are asking is that from what we saw in the TV debate, what does this tell us about whether he can actually do the job? Because there is a sense in which the TV debate is not the job of being a president. It's the job of trying to become president. There's a difference between governing a country and trying to get elected. However, it is the case that people will be thinking to themselves about Joe Biden's performance in meetings and his performance on stage. Does it tell us something about him being confused in meetings and in particular not being able to make decisions? We would think that a president makes decisions. I'm afraid to say the blunt reality is, and I've dealt with many people who are very close to government or at the center of government, is you can be cushioned by people around you. A lot of people around you can make the decisions. You can be carried by a team around you. So a lot of people are realizing that. And in fact, what they're really asking themselves is, what does it tell us about the judgment of the team around Joe Biden that they let him go on stage in such a state? I think that what people saw on stage did make them alarmed. And as a doctor, I myself, watching him perform on stage, I was worried for the man in terms of what was going on, because this was a very high stakes situation for which he would have been very well briefed. And I'm thinking to myself, what's going on here? Because it was not just one stumble, it was stumble after stumble after stumble. There was confusion. He was difficult to understand. And even the way he arrived on the stage, he looked actually with a kind of shuffling gait that made people think about Parkinson's, and he had a kind of expressionless look throughout, and he was mumbling, and all these things would add up to a possible diagnosis, and many doctors in the media have suggested this, of Parkinson's disease. Parkinson's disease is a neurodegenerative condition. In other words, nerve cells are dying, and it leads to a shuffling gait. It leads to an impairment in terms of the ability to move. He did look very frozen at times, and it can lead to actual freezing. And it is, though, more seriously, in terms of his relationship to being the president of the United States, linked to a dementia. There is a Parkinson's dementia. So I think I can understand why people would be alarmed by what they were watching, as to whether they suggested some neurodegenerative nerve cell death type condition like Parkinson's and a dementia. But people shouldn't be so alarmed, because if it really was the case, we'll see a repeat of that in future performances, so people will be able to make their mind up. Making an assessment shouldn't be done just on an hour's debate. It should be done over a period of time, and we'll begin to see what will happen at the next debate and other public performances. But the problem is that one is rehearsed, one is briefed, and that maybe public performances are not giving us a good insight into what it's like to be the actual president of the United States. I think we're now into a very interesting territory when we start thinking about the situation in terms of the relationship, the complex relationship between the medical team around a world leader like Joe Biden. And there is a very interesting historical precedent. Churchill's doctor, who became a member of the House of Lords, Lord Moran, very famously, while traveling with Churchill in the early part of the World War II, at a crucial meeting he was having with the President of the United States, Churchill had a cardiac incident, and Lord Moran had to wrestle with whether Churchill actually had a heart attack. And Lord Moran realized that international politics was involved, and if he'd pulled Churchill from the meeting with the US president to appeal for help, then maybe the US wouldn't come into the war. So Lord Moran was weighing up not just the medical needs of his patient, he was also weighing up the needs of the country. And I do think there's a tension with doctors who look after world leaders, where they start to think about other things other than just have an ordinary patient in front of me. They start to treat the patient differently than they would if it was an ordinary patient. And also there's the prestige of being the doctor to the president and the doctor to the prime minister. So all these things come together to mean that sometimes, oddly enough, although they have theoretically the best doctors in the world, they don't get the best medical care in the world. They don't get the care they ought to get, because the doctors are being weighed down by too many other considerations.